Hi guys, and welcome back to Mommy Tales. So today I'll be sharing information about the link between infertility and cancer. It's information that I came across and I thought it very helpful to share with you guys, because you might be knowing somebody who's probably received a cancer diagnosis and they're about to start whatever form of intervention, whether it's treatment, whether it is radiotherapy, chemotherapy. There's a way that their fertility can be preserved, and the method is actually available here locally in Kenya. So just watch this video, watch the information that Pauline Kibui will share with us, and I hope you can be able to share it with somebody else. I've been sharing with so many of my friends, so you can do the same. It can be very helpful to somebody else. So here it is.
My name is Pauline Kibui. I am a clinical embryologist and also a researcher in reproductive medicine. So there is already a huge link between chemotherapy and infertility, mainly because if the cancer is affecting the reproductive organs, it will definitely affect the reproduction system of especially the woman, but also the males are also affected. So you find that if cancer has already affected, for example, the ovaries, that means that you're not going to be cycling as usual or as normal. So the period or the interval at which we produce an egg every month is interfered with, and therefore the timing even to get pregnant becomes difficult, and also the quality of the eggs, if there is any release, then they are not of the best quality as well. So when somebody is going through chemotherapy, the drugs or even the rays may already affect the quality of that egg, and most times we find that actually they are affected to a level where you cannot even conceive. So chemotherapy has a huge link by the fact that reproductive cells are highly reproducing cells, and therefore anything that is abnormal, if it is incorporated into the genome, that means that you're not going to have the normal egg or even sperm being produced, and therefore normal conception is not going to occur. And that is where we have the link between the chemotherapy and fertility.
So if I'm a woman who wants to preserve my fertility, but I have to undergo chemotherapy, what are my options?
If you're going through chemotherapy, normally we advise that you do preservation, what you call fertility preservation, before you start chemotherapy. And that can be done. For ladies, we do advise that somebody preserves their eggs. So what happens is that somebody will receive hormones as if someone is going for IVF normally, to make sure that we have more eggs being produced, because normally we have only one egg being produced every month. But if we have to preserve the fertility, we need much more eggs. So you get hormones for a number of days, then you have more eggs being recruited or becoming mature. So we harvest that surgically, and then we preserve in a process we call either vitrification or slow freezing. So those are the same processes we do for your IVF patients. So for a lady, especially the young ones who are going through chemotherapy, they need to come before the start of chemotherapy. For men, the same. If they are going for chemotherapy, they need to come and also preserve their sperm with us. So what we do is that we do collect the semen. It's not surgical for men, it's very simple and very easy to collect, and then we preserve that just as if somebody is going through infertility treatment. And therefore when that person has finished chemotherapy treatment, they can choose now to have a child, either through IVF. But at the moment you also have another technology that is being carried on, where for women we can preserve what we call the ovarian tissue. So the ovarian tissue do not have to harvest the eggs themselves. So you get a part of the ovary, it is preserved. Once the person has healed from cancer, that tissue is put back into the ovaries and it continue working normally. Also for the testicular tissue for men. However, at the moment here in Kenya, I'm not sure if that treatment is available, but I know that it is so much being researched on. So if it is successful, it's something that will be used especially for the people or for children going through puberty. Or for example, you know that for ladies, you have to reach a certain age for you to be able to conceive. Also for the boy child. So if they are going through chemotherapy at an early age, so that technology is going to help them also preserve their fertility. And when they want to have children in future, then they can have their fertility restored, and so they can be able to get children normally. Yes.
So you said the first option, the harvesting, is available locally?
Yes, that one is very much available in the fertility clinics that are there in Kenya.
At what cost?
I cannot give a very definite cost, because different centers do charge different prices, even for IVF. But normally it should not be the same cost as doing IVF, because remember, you are just harvesting and storing the eggs or the sperm. So you should not be charged the full amount as if you are going through IVF. It should be, well, depending with how you agree with your service provider, and depending on the services they have. Once somebody has healed from cancer, it is not necessarily mandatory that they have to carry the pregnancy. Somebody may finish going through chemotherapy and they are so weak to carry the pregnancy. So they can recruit a woman, or what we call the surrogate mother, who can carry the pregnancy on their behalf. But because you already preserved the eggs and the sperm, so we can already have somebody carrying the pregnancy, but genetically that child actually belongs to this couple that preserved their gametes. So generally we call the eggs and the sperm gametes. So you hear me use that word more often. So, but also if somebody has come out of the treatment quite strong, they can still decide to carry the pregnancy, and therefore they can have this their gametes that they preserved being used for IVF, and then they carry the pregnancy as normal. That is if it's a woman. If it's a man, that's very simple, because they do not even have to be there for the woman to conceive. We can use that sperm that we preserved either to do insemination, or we can use that sperm we preserved to do IVF, and the wife will carry the pregnancy as usual.
Yeah, I hope you've learned something new just like I did. Be sure to share this information with somebody else. Like I always say, you never know who may be desperately looking for that information. So do share it with as many people as you can. Otherwise, thanks for watching, and see you in the next video.